Meeting today is an update on the situation on COVID in Elkhart County. And there are so many facets of that, and I don't know what Dr. Nafziger can speak to, whether it's the new variants, whether it's the new remedies post-COVID, whether it's boosters. I'm certain he has a lot to say. And we are all aware of the fact that residents of Elkhart County are among the least vaccinated groups of Americans. And that simply has got to change. So our next speaker, after Dr. Nafziger talks about the medical issues, is going to be Dr. Frank Lemus, who is a counseling psychologist, and both as a matter of working with patients or clients in his practice and his very keen powers of observation. He has identified 5 groups of vaccine resistors and considered what are some of the psychological issues that are holding people back from getting vaccinated. And he has some suggestions for us on how we can talk to our fellow citizens and encourage them to get the vaccine so we can pull out of this pandemic. So I would like to introduce Dr. Nafziger, who is the head of Goshen Health, and he has very generously been on our program before, several months ago in January when COVID was first a huge issue. And guess what? It's a huge issue once again. So after Dr. Nafziger is done presenting his comments, there will be a question and answer period, which will be moderated by Pastor Janet Shaver. So Dan, take it away.
All right, thank you for inviting me. It's good to be here with you this evening. They say a picture is worth 1,000 words, and so I was going to share some pictures with you. And I didn't want to talk too long because my understanding is a large part of the point of this meeting tonight was to answer questions people had. And so I could actually start with the questions that I received because they're kind of less visual kinds of things. The first question was, I received my shot last Thursday. Should I feel comfortable going unmasked at indoor events such as high school concerts, etc., where there are still a large number of unvaccinated people? And what wasn't said with that particular question was that probably a large number of those folks are also going to be unmasked individuals. Certainly in Elkhart County, as I go out into public spaces, for the most part, people are not wearing masks. And so that also increases your level of risk. What you can see on this particular slide is data from this COVID-19 risk website that Georgia Tech University has put together. And so you can go out to this website and you can click on Elkhart County and see an estimate of what the risk is for a particular event. So if you're going to this indoor concert event and 100 people are going to be there, this website allows you to make some guesstimate of ascertainment bias, or whether people are likely to be getting tested in your community or not. We do not do much testing of asymptomatic individuals. And so I think it probably is fair to estimate that for every detected case we have reported to the health department, there are probably 3 cases, for example, because 40% or more of folks are going to be asymptomatic or pre-symptomatic. And what this will tell you is that there's about a 60% chance that somebody at that event would be infected with SARS-CoV-2, or the virus that causes COVID-19. And so part of the question is really what one's risk tolerance is. And that's going to vary a lot with who you are, who your friends and family are, whether you have high risk people in your family that you're seeing on a regular basis, and whether you think you're likely to have responded to the vaccine or not. And so I don't think at this point in the pandemic, we live in an all or nothing world, and people need to make some personal estimate of what their risk is and how much risk they're willing to invest in a particular event. And that might influence whether you go to large indoor events with unvaccinated people or not, which I would have to say currently I'm not doing much of, or I try to avoid. I'm going to go back to the beginning here and just give an overview of where we are with the national numbers. This big peak that we saw last fall came down to late June when we were feeling good. And now we've all lived through the second peak. It looks very much like the numbers we've seen for hospitalizations across the country. Again, this second peak. And we're living through this second peak in terms of deaths as well. The good news is these numbers have started to fall. We're down about 15% from where we were 2 weeks earlier as a country. And it still is a fairly uneven pandemic. And that shows up on this slide where if you look back to December of 2020, most of the country was red or purple. Things improved substantially by June. Things were looking up, but since then we've had this spread that came from the south, moved up into the Midwest, and now is most heavily impacting Alaska and kind of the western part of the United States and upper Midwest, like Minnesota. We saw a fairly sizable uptake in vaccinations when they were first available, and we've really been struggling since May to get additional people vaccinated in the United States. And this is comparing the percent vaccinated to percent fully vaccinated, and we're still under 60% fully vaccinated. So we're not doing very well as a country in terms of getting people vaccinated. Obviously, if you're interested enough in the subject to spend your evening listening in, you probably have been paying enough attention to know that booster doses have been approved, and we're starting to see an increase in the number of people who are accepting or getting their booster doses. These are the Elkhart County numbers. We're obviously a much smaller community than the whole of the United States, and so you get some more of these irregular spikes up and down that may have to do more with reporting and testing availability than actual changes in disease incidence. But you see this kind of long, slow rise up until mid to late September, and then gradually our numbers have been coming down, although we haven't really seen a great impact in terms of hospitalizations, and I'll show you a graphic about that in a bit. Test positivity has been around 14% in Elkhart County, and these are the numbers that Barbara referred to that are disappointing, because I showed you those national numbers, which are not great, but the fully vaccinated, if you look at all ages in Elkhart County, we are at 38%. If you look at just the group that could be vaccinated, those 12 and up at this point, we're still under 50% at 47%. We do have better uptake in the 65 and older age group as people sense that they have significant risk. These are what admissions have done at Goshen Hospital over the last couple of weeks. We had been averaging between 4 and 5 admissions a day on a 7-day moving average. And fortunately, that really does feel at this point like that number is coming down. So that although we had 4 admissions yesterday, we're averaging between 2 and 3 admissions at this point. And this is just the last couple months of data. We had this kind of surge in hospitalizations or our hospital census in September, and we thought we were over the hump late in the month, but we've had kind of a second surge in hospitalizations. And again, we are coming down, which is encouraging. Typically, our hospital runs in the range of 58 patients if you keep track of how many people are in the hospital at midnight. So when we have 20 patients, it's about a third of our usual capacity is being devoted just to COVID patients at this time. This is a graphic that shows what's happened with admissions by vaccination status. So early in this year, fairly recently, after most people were getting vaccinated, you could see that this orange color, the number of people who were vaccinated and still had a COVID-related admission, was quite small, under 4%. And then as we went into May and June, it started to come up a bit, and August was 10%. And in September, it started going up even higher. And I think this was both a reflection of the Delta variant and some waning immunity from the Pfizer vaccine, which is what was used for most of the people that got vaccinated in Goshen. I think this number is a little bit lower this month, probably because some of us older folks have gotten our booster doses, and that may be already having an impact. This is the other graphic I wanted to show, just to reflect on where we are in the pandemic locally, and that is admissions by age group. So this 80 and older group in the orange, you can see, back in late 2020, before we had vaccine, it was as high as 30%. And this 60 to 79-year-old age group, some of these months was over 50% just in that age range. As the pandemic has progressed and as older folks have accepted vaccination, we're seeing this shift so that it's not hugely over 50%, but over 50% of our admissions now are in folks 59 years old and younger. So older folks are getting vaccinated, they're staying out of the hospital, and younger folks who've not been vaccinated are now making up a bigger share of the patients that are requiring hospitalization. The other thing I would just note is this is what's happened in terms of deaths at the hospital. We had the big spike that went with the cases in November and December. And we are now seeing, sort of a second bump in the curve related to this current rash of hospitalizations, where I would not be surprised if October is worse than September. Basically, we're having a couple deaths a week from COVID-19. And then I just have a couple more slides that I wanted to definitely show you. This is the impact of vaccination on deaths, and this is national number. This is not Elkhart County numbers, but basically, this is the curve for deaths for fully vaccinated individuals, this light blue, and you can see this big spike, which has been on the other curves I've shown you. These are largely unvaccinated folks that are dying at this point in time. And while there are individuals like Colin Powell who will make the news as being vaccinated and still dying of COVID, he had multiple myeloma, which impairs your ability to mount an immune response. And I believe he was also receiving chemotherapy that would have aggravated his ability to form an immune response to the vaccine. And so that is not a surprising finding. And he would be the kind of person that other people getting vaccinated would protect, rather than being evidence of the vaccines not being as effective as they should be. Overall, your risk if you're unvaccinated is about 6-fold for getting COVID, and it's over 11-fold for actually dying of COVID. And so it's a pretty stark difference, but the vaccines are not going to be 100%. And this is just a different way of representing data, looking at the percentage of COVID-19 deaths that are occurring among unvaccinated adults that are estimated to be preventable by vaccination. So this is this smallest green bar up here, which is a little hard to see, are actually the deaths in the among the vaccinated people. So this would be the group that Colin Powell would have fallen into. And this other blue line would be the deaths among unvaccinated adults who may not have been prevented even if they'd been vaccinated. But you can see the overwhelming number, over 90,000 of the deaths since June likely would have been prevented if people would have been vaccinated. And this is the other way of looking at or thinking about these deaths from COVID. And this kind of hot pink line that bounces around quite a bit are the COVID-19 deaths. So you can see in January of 2021, it was actually the leading cause of death in the United States, higher than this line, which is heart disease. Now, getting into September, it made its way back up to the second leading cause of death in the United States, not quite surpassing heart disease. But if you look at a specific age group, like the 35 to 54-year-old age group, COVID-19 was the #1 cause of death in the United States in the month of September. So we're seeing more deaths in younger people. It is, a leading cause of death at this point across age groups, particularly older age groups in the United States. While not every month it's a leading cause of death, it is a significant problem that's quite a challenge. I really only put one slide in here about the variants because at this point, Delta has taken over the United States and we're not seeing a lot of other variants, and there isn't very good data that there are other variants out there that are likely to surpass Delta. But the one that is been somewhat concerning, but is not yet classified as a variant of concern, is this Delta Plus, or a subvariant of Delta that's been called AY.4.2. It is up to 6%. I've heard as high as 10% of the sequenced isolates in the United Kingdom. It has not taken over in the United Kingdom yet, but it is getting on their radar screen. In the United States, it's really only been found in 4 states, and it's been still quite rare. There is the suggestion from the UK data that it may be more transmissible than the Delta variant itself, but there really isn't any data at this point that it's a more deadly virus, and we're just going to have to keep an eye on it. I was going to tackle the questions that were posed to me. I kind of tackled this one all over about indoor events. The other question was, why don't people trust the health department in our area, no matter what they're telling you? And then they go on, I think this is more of a comment than a second question. And I don't have a great answer for this. This is a sociologic and political question rather than a medical question, but it's discouraging for someone who's followed the pandemic closely to see that people aren't willing and able to trust the health department to give us good guidance and to follow that guidance. The other question was, if vaccinated people are still getting COVID, why does it matter if more people get vaccinated or not? Does mass vaccination help? So I've shown you some data on the slides earlier that it is true that vaccinated people can still get COVID, but it's keeping people out of the hospital. It's keeping people from dying. It's keeping people from developing long COVID. And really, this gradient of protection shouldn't really be a surprise, because we see this with other vaccines as well. Vaccines in general, and this vaccine in particular, protect the best against actually dying, less so against hospitalization, but still quite good against that, even less against mild to moderate illness, and even less against all infections that have any symptoms, and then even less against the asymptomatic infections. And so it's also clear that vaccinated people do appear to shed less virus for shorter periods of time and infect fewer people, particularly where this has been looked at is in household studies, where they infect fewer people who live with them. So it does make a difference in terms of the overall shape of the pandemic by getting people vaccinated, not only in preventing death, not only in keeping people out of the hospital so that other people can get their care and the surgeries they need and so forth, but at reducing infection and limiting the disruption on all our lives. This next question was, are all the doctors, nurses, support staff at Goshen General required to be fully vaccinated against the COVID virus strains? Well, they put the all in capitals. And so I read this as saying, like, I don't want to be vaccinated if everybody else, like if everybody isn't vaccinated, then I don't want to be vaccinated. And I guess the question I would pose back would be, do you want to be the last person in the world vaccinated against a potentially deadly disease? I don't think that relying on any group, whether it's healthcare workers or people who serve you at a restaurant or whatever, to insist that everybody be vaccinated before you get a vaccine is probably the standard that is going to be most helpful. I would say that the Biden administration appears to be poised to require vaccination of healthcare workers employed by organizations that take or receive Medicare and Medicaid funding. So it is anticipated that there will be a mandate for healthcare workers, but it's also anticipated that there'll be medical and religious exemptions that will allow healthcare workers to opt out of getting vaccinated as well. And I will stop there and see if there are additional questions.
This is Sandy Kurtz. I was wondering if the vaccinations will be good for the new A1 4.2.
Yeah, I would anticipate that they will be. It looks like the current vaccines we have provide fairly broad cross protection, both from the original strain and Delta. There have been strains that look like they are relatively more vaccine resistant or less likely to be, protective with the vaccines. But Delta, fortunately or unfortunately, has proven to be so much more transmissible than the other strains that it's won out, and those other strains have not taken over.
Any estimate if we're fully vaccinated, i.e. the booster and the first two vaccines, is there any estimate out there as to how long this protection might last?
Well, it's still that's still a fairly controversial subject. The reality is this virus has not been around yet for 2 years. And so I think most people don't think at this point that we're going to require yearly boosters. I would also say that most infectious disease specialists probably don't believe that if they've gotten their third dose of a COVID vaccine, that they'll never, ever get another booster dose. But it remains to be seen whether, we're going to need boosters at 5 years or 10 years or how long that would be. I think, unfortunately, if we don't do a better job at vaccinating the world, then we are more likely to see more variants come up. And the more variants we have, the more likely we are going to need booster doses to combat those. I've read that boosters available only to those 65 plus and people with high risk factors, but I'd heard informally that anyone who wants it can get it. What do you advise for someone between 55 and 65 regarding a booster dose at this time? Well, I can give you, I'm going to share my screen again and give you the details of what actually got approved for Pfizer. And this is similar for Moderna and now J&J, basically, where folks 65 and older, 18 and older living in long-term settings. So think a nursing home or another congregate living setting. And then this 50 to 64 with underlying conditions. And then 18 to 49, these are folks who may receive versus basically it's recommended they receive. So 18 to 49 with an underlying medical condition, you can also receive it. And then 18 to 64 with increased risk due to working or residing in certain settings. And this is the list the CDC put together for who falls into those categories: first responders, education staff, food and agricultural workers, manufacturing workers, corrections workers, postal service, public transit, grocery store workers. It's a pretty long list. And essentially, people are just being asked to attest that they fall into one of those groups. So it is true that a healthy 25-year-old, it is not recommended. And if they're not in any of those working categories, they would not qualify under these recommendations. But it's a system that's operating on trust. So I personally think that someone who's between 55 and 65 is at a reasonable risk from COVID-19. And while I would anticipate the odds are quite good that you would do well even if you got infected at this point, you can see that there are broad occupational categories that would allow you to get a vaccine even if you are perfectly fit, healthy, and have no high-risk medical conditions. The other thing I would say is that obesity is one of the conditions that would be an indication. And most the folks that live in Indiana who are 55 and older are either overweight or obese and would qualify on that basis.
One of the things that concerns me is the relative economics of caring for patients in ICU versus the cost of a $40 vaccine. I've heard figures that go, run in the area of thousands of dollars for caring for somebody who has opted not to get the vaccine. And I think your chart said that represents about over 80% of the people who are hospitalized. And I have to tell you, it really burns me because, this is not an efficient use of medical resources. And I also understand that a lot of people who need urgent care are precluded from getting it because ICU beds are full of COVID patients. So that's a bit of a beef, but I'd kind of like you to talk about what your experience is as administrator of a system, because healthcare is costly.
Yeah, well, it is kind of ironic that people are always critical of American healthcare for, being a disease-oriented treating system and making its money off people's illness and misfortune. And here we have a vaccine that can keep people out of the hospital, can reduce their hospital charges, save them from suffering from symptoms of long COVID or the discomfort of being hospitalized or the misfortune of dying, and people don't trust us to get the vaccine. It's difficult. I think it really speaks to the fact that that's probably not the thing that determines whether people make the decision to get vaccinated or not. Their healthcare costs are not what's driving that decision. Those future costs seem unlikely to impact them as individuals, and so that I don't think that factors heavily into people's decisions about whether to be vaccinated or not. I guess there's another comment or question about the Moderna booster. Had to search pharmacies in this area to give the Moderna and found out some CVS do and some don't. I told my 70-year-old friend who needs Moderna, and she said, She had no idea it was available to her now. We may need some better way to communicate this better. Yeah, well, the Moderna boosters have just been approved, and they were on a later cycle than the Pfizer boosters because the vaccine was approved later than the Pfizer booster. And the FDA just reviewed that data last week. And so it's just been really now that the information is being disseminated from the CDC about those recommendations for the Moderna booster and the J&J booster. So I agree, it probably could be communicated better, but it is, if it makes you feel any better, it's really just been in the last week or so that those recommendations have been finalized.
I'm saying too that, I'm very interested in it and I wanted it the minute it was available, but for some people that don't want to search on the internet or anywhere to find a spot, how do they get this information where they should go?
Well, I think the Indiana vaccination website, rshot.in.gov, has that information. And also 211, you can call 211 and get that information. The other thing that the FDA and now the CDC have approved are basically mix and match boosters. And so even if you got Moderna, you actually could get a Pfizer vaccine now, or if you got Pfizer, you could get a Moderna booster now, which should simplify things in terms of finding a vaccination as well. It's still recommended that that primary series be of one brand, but after your initial series, the booster dose can be mix and matched.
Well, I want to thank you for being here. I hate to stop this because it's such a great conversation and more questions are coming up. Anyone would like to have more questions, you can continue to put them in the chat and we can be sure to make sure that you get the answers to those. But so we'd like to say good night to you. And I'm going to introduce, thank you so much. It was so much information and it was something that gives us a little peace of mind and a little hope for ourselves that are vaccinated. Okay, so we're going to introduce now Dr. Frank Lemus. I know him and he might want us to call him Frank. Hello, Dr. Lemus or Frank.
Hi, how you doing? And I was excited to hear all the information that the doctor presented. I had about 5 different questions myself, but everybody asked them. So I'm grateful for his time and to give us some details about the medical part.
Well, thank you. Okay, so we know Dr. Lemus, for all of you who were not with him before, we've had a Zoom with him talking about loneliness, and he helped us find ways to help others in their loneliness and in our own loneliness. So we thank you for that. And so tonight, and Dr. Lemus has a PhD in counseling psychology, and he's written books, and maybe he'll talk a little bit about that. But tonight he's going to give us some ideas of why people aren't being vaccinated and how we can have good discussion with them and all the emotions that surround them. I wanted to mention just a short story that Barbara asked me to share. I was watching the PBS NewsHour one night and they were interviewing Arkansas's director of health for the state. And they were asking her about they were unvaccinated. This is when the time when it was really hot in Arkansas. And she said that the state was so rural that a lot of people, they didn't have any COVID in their area, and that, so they didn't really think they were being affected by COVID. It didn't make a difference to them. And so then they asked her, well, what are you going to do about these people that are unvaccinated? What should we do? And she said, first of all, which really touched me. She's very sincere, and I just really appreciated that we should be compassionate and empathetic, because she said all the people that weren't vaccinated in her state, many of the people were just ignorant of the facts. They were getting so much they were getting so much misinformation, they couldn't tell the truth from the false. And she said she thought empathy and compassion to help them understand and for us to gain trust with them so that we're able to talk to them a little bit more about that. That was really, I thought that was really a different, just a different way of approaching it than I was used to hearing. So
first of all, I want to thank Barbara for inviting me to be a part of the important discussion today. I'm very, very grateful, and I'm always excited to do these presentations. Many times I learn as much as anybody in the audience about the new things that are being presented. I'm going to present some options about how to best understand and connect with vaccine hesitant and vaccine resistant people. I'm going to provide a working framework for addressing this unique group of unvaccinated community members. First, people are complicated. Speaking to what Jana was talking about, we're not all alike when it comes to dealing with our individual health issues. We all have individual preferences, individual thoughts. Imagine how much more complicated it becomes when we must deal with a global pandemic, and then add to this the political dynamics that cloud our national pandemic response. Our goal as individuals within our communities should be to encourage everyone to care about the health and well-being of others as much as they care about their own health and well-being. In my practice, I use a framework that has 5 categories when I'm discussing the issue of vaccine hesitancy and vaccine resistant people with my clients. So the first thing I do is determine which of the 5 categories best fits the person who is resistant, rebellious, reluctant, or resigned to not get the vaccine. So here are the 5 categories that I use. In the first category has the person who feels angry, they're mad, and their survival brain dictates that they must go to the fight response. And then they act out the battle. That first group, they fight. They're in it for the fight. They want the fight. The second category has the person who feels rebellious, and their survival brain dictates that they must go to the resist response. And then they act out the confrontation. They resist. They look forward to the confrontation. The third category that I find has the person who feels disconnected, and their survival brain dictates that they must go to the avoid or ambivalent response. And then they act out being unmotivated, or they just unplug. They avoid. That third group actually avoids. They're not so much wanting to fight. They don't necessarily want to go into confrontations, and they resist. They avoid for many, many, many different reasons. And we'll talk about those as we go along here. The fourth group is the person who feels confused, and their survival brain dictates that they must go to the numb, freeze response. And they act out just being frozen or stuck. They actually just numb out, right? They don't go here, they don't go there. They just get numb and stand still. The fifth category has the person who feels fear, and their survival brain dictates that they have to go to the keep away. They hide, they flight response, and then they act out running. They keep away. All right, so there's the summary on the slides, 5 different categories. You'll notice that probably the ones that are the most difficult to deal with are in category 1 and category 2. Now, first of all, you got to know how I just get a chuckle out of this because I tried to find an acronym for the categories, and I had to really stretch for that 5th one. All right, but fight is the F in Frank, the resist, the R, the avoids is the A, the numbing out is the N, and the keeps away, which is the flight, that's the K. So an easy way to remember the different categories is Frank. All right, so the next piece is the second thing I do is to keep in mind 5 very basic principles when I'm dealing with this unique community group of people, and they are part of our community. People's reasons for their hesitancy and resistance, they're personal. And many times people aren't going to share their personal stuff with you, but they're very personal. Second is a person's belief system shapes their identity. And this one I really want you to know, to pay attention to, because when their belief system shapes their identity, so when you challenge their belief system, you are challenging the identity they've adopted and take pride in. And that's the one that I really see the most people when they're stuck. Okay, and those are the ones that are the hardest to reach. And then we're really not just talking about the vaccine or their belief about the vaccine, they're talking about their belief system and the identity that they've adopted to that. The third basic principle I use is empathy, understanding, and respect is essential if I want a good connection and relationship with this unique group. 4, be aware that a relationship is built on 90% listening and 10% talking. Last but not least, who people trust is what drives their decisions regarding this vaccine. There are 2 tools that I believe are essential in dealing with this unique community group of people. The first tool, and in the last time we were talking about loneliness, really is what I call the relationship model called Sanity. We don't have the time to go through the whole Sanity model to help you build the relationship skills you need to change or influence the vaccine hesitant or resistant people. For those of you who are interested, this is the book that really shows the different concepts and principles revolving relationships and the 6 skills to strengthen relationship bonds. Okay, and you can actually get it through Amazon. It's a pretty cheap little book, but it's a really good basic foundation on relationships. So relationship DNA and the Sanity model will teach you the skills that give you the best chance of connecting with this unique community group of people. So for today, there's only time to go over a real quick summary of the Sanity model. There are 6 principles that healthy relationships are built on. If people choose to have a relationship with you, they need to feel these 6 things. An easy, simple acronym to help you remember the 6 things is the word Sanity. Now, this is the most critical tool that you need to have if you're really going to have an impact on influencing or affecting the decisions that people make about choosing to get the vaccine. This is where I think it really goes once you decide what category to fit in. This is the most important part of it. Because when you're talking about sanity, the S in the Sanity stands for safety. For people to take what you're giving, they have to just feel safe and they have to feel protected, not attacked. A, they have to feel accepted, like you really accept them as people, understanding their feelings, understand that they're people with emotions, and they're not just objects like a couch or a chair that you can lecture. The N stands for nurturance. And nurturance really is about your emotional gas tank being filled up versus drained. And I've heard people try to convince people to get the shot, and at the end of me listening to them, I'm drained, and they weren't even talking to me. The I stands for importance. Those people need to feel that you see them as valuable, significant, and worthy. The T stands for trust. They need to have and feel dependability. Your word is gold. And the last principle, if you're going to have an impact on the decisions people make about the vaccine, is the yes. They have to feel that they're better with you than without you. These are the 6 that you use to build the skills, to build the relationship with those people so that you can influence or have any effect on the decision that they make. These are the 6 that are critical to have. Okay, these are the ones that people really do need in order to enter a relationship with you who's trying to convince them to be vaccinated. Make sure that the other people feel these 6 things. Making sure that they feel these 6 things really does give you the best chance of influencing their decision about vaccines. So now we've covered 2 of those pieces, right? One, the different categories, and the skill set you need for a working relationship. And that working relationship is really where you're going to have the greatest impact in helping people change their mind. This is where I may differ from other people. Because if you have limited time, then spend your time only with those people who have a chance that you have a chance of influencing or reaching. And that's hard because most of us are good-hearted, good-natured, and we want to take our energy and give it to everybody. But I know for me and the people that I work with, their time is limited. So spend very little time with the people who fall into that category of 1 and 2, who crave the battle and welcome the confrontation. They're really not there to hear you out, to listen to your advice, unless you have developed that relationship with them that they're going to give you that connection. For most people that are in that first category, they truly want to fight. They feel angry and they really want the battle. It doesn't matter much what you say. The person in the second category resists. They just feel the rebellion and they want the confrontation. They seek it out. Spend your time with the people who fall into categories 3, 4, and 5. Those people who avoid, those people who are feeling numb, and those people who really are in flight mode or that keep away. Now, these are the ones that I really consider as reachable. And that doesn't mean you can't. There's some people who will be able to reach that person in a category 1 or category 2, but you're going to get beat up pretty well as you try to impact them and influence them, because they're really not there to listen to your expertise unless you have a position in their lives that you have developed that sanity with them. In this next slide, these are the 3 categories that I think you really do have an impact and can change. That third category, they're avoiding, right? They just feel disconnected. Those are the ones that they're not sure. They're not really involved in it. They're kind of unplugged. The fourth category that's reachable, they're kind of numb. They're confused. They've been bombarded with misinformation and one person saying this and another doctor saying this and another doctor giving the exact opposite advice. They just feel confused and it just numbs them out. The next reachable group is the ones that are really in flight mode. They're scared. They're afraid. So they run and they hide. Their main responsibility is to protect themselves by getting away. Now, it's important to mention that to build a healthy relationship, do not use your energy or connection arguing your point. I can't tell you how many times I've heard people try to argue with people. Don't do that. That's the worst thing you could do. You actually embed them in their thoughts that they had originally coming in to the discussion with you. Remember, we all have the tendency to resist when we're told what we should or shouldn't do. It's a natural and normal human response people have. If you focus on telling them the solution to the problem, unless you're a doctor, an MD, that they go to you for that, like you say to them as a friend, you need to get the vaccine because it's only natural for people to immediately take up the other side of the argument with, well, it's only a Democratic conspiracy and you're just a sheep following along. This is where Sanity model is such a valuable tool. It's all about connecting and developing a working relationship. That working relationship is what gives you the opportunity to influence people to change their mind. Now, the second tool is what they call the trans-theoretical model of change developed by Prochaska and DiClemente. These are the stages of change model. Again, this is really a half a day to a full day workshop when we talk about these 2 tools. But again, to learn the important steps to change people's mind, to influence them, it requires a unique set of skills. If you're inclined to, look up the theoretical model of change. Prochaska and DiClemente do a great job of showing the steps necessary to move people to use in order to move them to action. Okay, I'm going to cover only 6 of the catalysts. There are 9 of them, and a lot of them I don't even use all 6 of the catalysts when I'm working with clients. Each of these 6 catalysts are important for you to know so you can help this unique community group. And I stress it's a community group. These are your people still. They're your community. Even though they think different than you, believe different than you, those that are reachable are really worth taking the time and energy to connect with them. But you're getting no place unless you connect with them. But let me just real quickly give you the catalyst that people go through when they do change. First, people, the most important catalyst is the helping relationship. Again, here's the Sanity model, right? If you can develop that relationship of sanity with those clients, you become part of their helping team. Provide people that's valuable for them, for you to support them, okay? That you're of value to them, that you're a supporter. There's different ways that you can be a helper to them. Be the person who's willing to help them get to the vaccine side and to help and support them to feel more comfortable at getting the vaccine. Building a helping relationship is essential to helping them feel safer, clearer, and more involved. Something like, you can count on me to help and support you in any way that I can, like helping you make an appointment or driving you to the vaccine site. Just let me know what I can do to be a helper. That's the first one and most important one. The second one is really about consciousness raising. Help them by raising their awareness of the accurate information and facts about vaccines. Use the format, did you know? And then state a fact that's backed up by research, not just your opinion. Did you know that this is a public health crisis? Did you know that this is a pandemic and not a political stance? Did you know? And then give them something that's backed up with research. That is consciousness raising. And again, you can see being a helper is what allows you to give them this information. The third catalyst is really social liberation. That helped them to understand what is holding them back from being free to get the vaccine. You'd be amazed at the reasons that people have for not getting it. And for us, we think it's just because it's political, or they're just going to want to battle, or they just want to go into a confrontation with you. And really, when you really ask people what is holding them back, it's amazing what scares different people. Something that scares you may not scare somebody else. Something that doesn't scare me may scare the crap out of somebody else. Help them discover the barriers that are keeping them from getting the vaccine. The fourth catalyst is emotional arousal. Help them by providing them the stories that arouse their emotions to get the vaccine. Wow. What would it be like to unintentionally pass this on to someone you love and then they die? Help them by exposing them to other people who were hesitant or resistant to the vaccine and then change their mind after getting COVID and almost dying. Help them see other people's experiences about changing from anti-vax to pro-vax. Would you be willing to watch these testimonials of people who were against the vaccine and then got really sick from COVID and now talk about what they would do differently if they could go back in time? That's emotional arousal. The fifth catalyst that you can use as you're working with people to help change and influence them is help them by providing feedback and encouragement so they can determine how close they are to being ready to get the vaccine. Some people think they're never going to get it, but really when they talk, it's like they're right on the verge. Help them evaluate whether the values are matching their behaviors. Help them assess how far they have really moved towards getting that vaccine. You say that family is important to you, but you're also saying that you're not going to get the vaccine. Help me understand how not getting the vaccine protects your family. I just want to know. I'm just curious. Can you help me out with that? Not that you're arguing, you're not putting them down. You're just literally helping them self-evaluate. If you run into ongoing resistance here, you need to evaluate your own effectiveness as a helper. If you start getting people pushing back, fighting with you, confronting, arguing, resisting, here's where you have to go back to catalyst 1, 2, and 3 to determine if you've done enough in each of these other catalysts to move them forward. Okay, so that's the fifth catalyst. The sixth one is really get them to verbalize that they're going to get the vaccine and then ask them to make a commitment. Once people do all the work, all the first five catalysts, then is, do you realize how far you've come? It sounds like you really are ready to make the decision to get the vaccine. Can you make the commitment to get the vaccine before next weekend? Those are the steps to get people to move, to change from one being stuck in one place about not getting it to the place where they're willing to get it. So for the time that we have left today, let's review what's most important for you to remember. Okay, we could do this as a half-day seminar. And I've done this workshop and it's taken 4 hours. You could do a full hour or a full day in doing both of these tools, okay? But as simple as possible, it comes down to this. Let's see if I do it. Way ahead of myself, I think. All right. In summary, if you have limited time and resources, spend very little time, if any time, with those who fall into the angry who fight and the rebellious who resist categories. Your time is best spent focusing on the people who fall into the categories of disconnected. Those are the ones who avoid, the confused who are numb, and the afraid who just keep away. Now I'm just kind of bouncing back and forth. Since creating a healthy relationship is the most important change catalyst, use the Sanity model to create the relationships that are built on the principles of sanity. Okay? That is really what you want. This is the most important part of helping people change. They must feel safe. They must feel accepted. They must feel nurtured by you. They have to feel valuable, significant, and important. They have to trust you. They have to know that your word is gold, that you can depend on it. And more than anything else, that they can say, I'm better with you than I am. These are the steps that you use once you develop that relationship and you've identified the group of people you have the greatest chance of influencing. These are the important steps to follow. And again, thank you for your time. I should mention to you that what we did today is usually a much more detailed and involved, but you got the basics. And that to me is the most important part, is that if you're interested, do look up the relationship DNA and sanity model and Prochaska and DiClemente's theoretical model of change. They're great if you have the time to sit down and read, because this does give you the different steps of change. I hope it's helpful. Thanks for your time. I wish you the best in influencing the vaccine hesitant and vaccine resistant people in your communities that are reachable. That's it. Thank you for taking the time. I appreciate it. I know it's a lot, but it's when you break it up into only 3 things, you know, just make sure that you know who you're dealing with. Make sure that you have the skills to connect with them, and then follow the stages or the steps and the catalyst to get them to where you want to get them.
I was thinking the one good thing about recording this, I was thinking you were giving us so much good information that I'm going to go back and listen to the recording again and take more notes, because I'm pretty interested in that model of change catalyst. I'm pretty interested in that. That just gave me a lot to think about. So I appreciate that.
And honestly, when they do a workshop, it's a weekend workshop on the theoretical model of change. Prochaska and DiClemente were one of the first to really be able to research the steps that people go through to change. All right. And for me, there's 9 of them, but I thought I would just give you the ones that I think were important to deal with the people you're trying to deal with. Okay. But both of those models are really good. And honestly, the sanity model, it is really what comes first. I believe if you don't have a relationship with the people you're talking to, like our doctor, if he doesn't have a relationship with his clients, they're not really going to listen. They're going to walk out of that office. But it's the best relationships the real doctors, the medical staff who have the best relationship with their clients who get the best results. Okay. So hopefully that helps a little bit.
I want to let everyone know that Dr. Lemus does online counseling as well. He does actually during the COVID, all his patients were online, and that was really helpful to them. If you have a need, I don't know, my husband and I think that everyone needs counseling in some time in their lives. That's really important to have someone to share your thoughts with that you can't work on your own. So thank you for that. No.
All right. See how good a job I did at teaching? I'm so proud of myself. I really am.
Could Dr. Nafziger quickly address a few of the most common objections, misconceptions people are likely to raise? For example, that vaccines are more deadly than COVID, or that getting COVID is no big deal.
There are a lot of different misconceptions that different people have. I mean, a number of the misconceptions have been around fertility or pregnancy, and the data there pretty clearly shows that COVID is a bad disease for pregnant people, and they have higher rates of ending up in the intensive care unit or dying. And people do not have higher rates of miscarriage. There are lots of people that misinterpret the VAERS system. VAERS is a system that the government uses to kind of screen for or to gather potential adverse events following vaccination. So if I get vaccinated and I die in a car crash on my way home from the vaccine site, that can be reported to VAERS, whether or not the car crash had anything to do with the vaccination or not. And I think people misunderstand just causality. If something happens after something else, then they assume it was the cause, even though it may be unrelated. And kind of the classic example there is, you know, a child that has their first seizure in the doctor's office minutes before they're to receive a vaccine. Well, if they would have been vaccinated a few minutes before, it'd have been very difficult to convince that parent that the vaccine didn't cause the seizure. And I think there are people who look at the VAERS system and think that the COVID vaccines should prevent every disease and every cause of death for, you know, weeks to months after someone receives a vaccine. And obviously that's not what the vaccines are intended to do, nor would we expect them to do it. I always remember a patient that I saw quite a number of years ago who was convinced that he got colon cancer from his flu vaccine because he'd gotten his flu vaccine in the fall, and he was tired and didn't feel well ever after he got that vaccine. And then about in January, he was diagnosed with colon cancer, and he was quite sure that the vaccine caused his colon cancer. We know that colon cancer doesn't come up and form large tumors in weeks, and that was a coincidence. But in his mind, he was sure. And so there are a lot of these events that happen in time where people draw causality conclusions, where when we do the science, we find that they're unrelated. There are certainly rumors out there that COVID doesn't exist, or that more people die of vaccines than of COVID. I showed you a slide from Goshen Hospital's experience with more than 100 people that have died of COVID. I don't know of anybody who's died from the COVID vaccine. I haven't even seen anybody hospitalized from a COVID vaccine. I think maybe we had one person with an allergic reaction that required some additional care following their vaccination. But you know, even the vaccine side effects that appear to be linked to a specific vaccine, like this unusual thrombocytopenia syndrome following the J&J vaccine, you know, those side effects are incredibly rare. And I think most of the people who died from those incredibly rare side effects did so before they were really recognized as being related to the vaccine, and when people didn't know how to treat them like we do now. There are other side effects like myocarditis in particularly in teenage boys following the Moderna vaccine that are very rare and are limited in time, but are scary to parents and to kids because they are linked to the vaccine statistically. But again, those are quite rare, certainly more rare than the bad outcomes from COVID. And that's why the vaccines have been able to get emergency use authorization, or in the case of adults, full approval, because the benefits far outweigh the risks to the individuals getting vaccinated. True, there's a substantial percentage of people who have asymptomatic infection with COVID, the virus that causes COVID. And so it is easy for people to conclude that it's not a big deal if that's their experience.
I'm sorry that we've run out of time. I'm sure you have more questions, but I'd like to end this before people just start dropping off. So let's just give a little hand. Thank you to Dr. Lemus and Dr. Nafziger. That was very helpful. Thank you for committing your time. I know that's not always easy. So blessings, and hope to have you on again.